里现在是你跟陈医师的私人的一些讨论的时间，然后大家可以来听听看年轻的女生关心荷尔蒙什么样的事情。好，我把时间先交给你咯。
好，谢谢你。And hi, Dr. Chen. Thank you so much for being here with us today.
My pleasure. It's kind of fun to be chatting with everybody.
I know, everyone's so excited to see you too. So thank you for taking time out of your busy day to be here with us today. And just to kick things off, I know a lot of people think that women only start to worry about hormones as they get older and closer to menopause, but there's been a huge increase in awareness and curiosity in younger women now, like among my friends. I'm in my almost mid 20s now. I think it might be because there seems to be an increased prevalence of issues even among us now. So kind of using that to jump into our first question, we often hear from young women that we feel really lost navigating hormonal health. We don't learn about it much in school, and then when things go wrong, we often blame ourselves. So we're curious, what are some of the primary root causes of hormonal imbalances that cause irregular periods and infertility in their 20s? How much of it is actually in our control versus more external environment factors?
Yeah, there's so many different causes of hormonal imbalance, but honestly, I have to say, part of it is really, I think, the obesity epidemic too. And as well as, I'm sure, microplastics don't help, and just the kind of stress we're under at this, at the current lifespan of, when I was a kid versus the kids now. Like my cousin and I always look at the younger generation. We're like, looking at what you guys have done, we would have never gone into the college, So I think stress, both mental and physical stress, right, is probably the easiest way to explain some of the hormonal imbalances. So, but unfortunately, stress is very difficult to quantify, right?
Yeah.
So, but I do see, when you really, I do see a lot of kids that are unfortunately already overweight. Mm-hmm. And when you're overweight, it's going to throw your hormones off, right? When you're underweight, it's going to throw your hormones off too, because anything that the body perceives as a stress, it's going to want to protect itself, right? Mm-hmm. So, we have periods for the sole purpose of having babies, right? That's kind of evolution. So even though society is pressuring us not to have babies at 14 or 15, but really when you look at it, the healthiest moms and healthiest babies are young kids, young people.
True.
So, but in terms of physical health, right? Because young people have healthier eggs, healthier kids. Their bodies are able to rebound from pregnancy, tolerate pregnancy way better, significantly lower risk than the current average age I see is almost like over 40 now. So it used to be, I was like, oh, you're 38, you're having a baby, that's kind of old. Now I'm like, oh, you're 38, you're kind of young, So people are putting off pregnancy because of financial, emotional, societal pressures, right?
Absolutely.
And so our eggs are older, so our kids, whatever embryo we conceive are a higher chance of chromosome abnormalities. We have increased difficulties conceiving as well. So, but that's a whole different issue. But for the younger people, I think our diet, our lack of exercise, all those things contribute to the obesity part. So that overweight, underweight, all causes irregular hormone cycles, right? And then same thing, mental stress, you're totally you don't know how many times I see these kids that start college, 9 months of college, they don't have a single period. They come home for the summer, 3 months, every month, regular cycles. So that's just purely mental stress, right?
Yeah.
And then also, a good thing is good, but too much of a good thing is not necessarily better. So you look at the ballerinas and the extreme athletes, right? They don't have a period either. I mean, they're incredibly healthy, but they don't have a period either because their bodies are too stressed.
Absolutely. No, thank you so much, Dr. Chen. And I used to be a competitive dancer myself. So definitely that's how I lost my period. So it's funny how doing dance and then going into schooling for so long definitely caused my hormones to be like completely off balance, and it took a while to come back. So I kind of wish I heard this 6 years ago, but
Your fault, it's just the body protecting itself because
it truly is.
yeah, I mean, like if you're too underweight, the body's like, I can't even keep myself alive. How am I going to keep a
A
pregnancy alive?
baby. It's like you're just not ready for it right now.
Yeah.
Absolutely. And thank you so much. I think we'll use that to segue into our next question. So a lot of times in our 20s, we think we're invincible. So we don't really expect hormonal problems, and we often dismiss early warning signs. In fact, when I was doing a little bit of research, we actually found that 70% of women are unaware that conditions like PCOS may have developed from earlier hormonal irregularities. What are some critical early signs that young women are most likely to overlook or dismiss as normal?
I mean, that it's going to vary between populations, right?
Mm-hmm.
So, I mean, when you have a monthly regular cycle, that tells you a lot, right? Mm-hmm. That tells you you're ovulating, you're cycling, your uterus is normal, it's shedding. So if it deviates from that, that would be the first hint something's going on. But by the same token, I tell people to expect your period like clockwork, every month, on time, same flow. That's asking a lot from your body. So, like I'm not one of those that's overly anxious because I don't think anxiety is good for you either. So like
how did it go way faster?
Yeah. I mean, you don't know how many patients I have who are like, I haven't had a cycle for 3 months. And then they make their appointment with me and they're like, hi, kidding. I just got it.
It always happens right when you're about to see the doctor.
Yeah. Because I think part of it is just the release of the mental stress. Like, how come I haven't had a period? It's been 2 months. It's been 3 months, like, okay, I need to go see a doctor. And then that stress goes away. Right. So then you're like, oh, I'm all good. So I think, if you, especially when you're young, there's not a whole lot of bad diseases when you're young. Mm-hmm. So when you're young and you miss a cycle or two per year, it's not a big deal. But when it starts, and then same thing, I mean, there are times when you do need to seek medical attention sooner than later. I mean, I've had a 16-year-old that we had to transfuse them because she has such a heavy period that she lost way too much blood, right? I mean, those are urgent issues. But usually too little is not worrisome, but too much is. So like, if you don't get your cycle as often, you skip a cycle, usually there's nothing horrible, nothing that, that's life-threatening, right? But, and then, if most of the badness is when you have too much bleeding, and it doesn't matter if you're 20 or you're 40, right? Or even 60. Because too much bleeding can cause anemia. That's a very simple, obvious thing. But other things like if you worry about, fibroids or polyps or those kind of things, it tends to cause either bleeding that's excessively heavy or bleeding when you shouldn't be bleeding, or bleeding like in between cycles that are just unpredictable. So I think, when the bleeding is more than what's typical, what should be normal, I think that's something to kind of pay attention to. But by the same token, like, I mean, I'm not going to worry about like if your cycles are normally 6 days and today's 7, this month is 7 days. I'm not going to lose sleep over that. Right.
Absolutely.
So.
Yeah, no, that's really helpful for us to make sure that we're not creating additional and excessive anxiety for ourselves, which is, again, just like you said, an additional stressor that we don't need, versus when we need to know we need to seek medical attention. Because I definitely know I've had a couple of friends who have extremely heavy flows, and then because they didn't see anyone for it, they ended up developing like iron deficiency, and then afterwards they had to get put on IUDs or other contraceptives to help them regulate. But it's been helping them a lot because it affected them in so many other areas of their lives.
Yeah, but it's really crazy how much women put up with.
Yeah.
Like, I've had patients who would have such heavy periods every month, right? So they get used to it, right?
Yes.
So they develop a slow anemia. And then I look at their blood count. I'm like, your blood count is at half of what's normal for us. But they're still driving their kids around. They're functioning, and then I'm like, are you lightheaded or dizzy at all? They're like, oh, well,
it's
no,
normal.
not really. But then once we treat it, they're like, oh, I don't get winded when I go up the stairs. Oh, I actually remember things, you know? So it's crazy what women put up with.
No, absolutely. I think in society, we're kind of told to not talk about these things because we're just supposed to put up with it, right? Because it's our normal cycle, but everyone's normal is different. So it's truly crazy.
Yeah. I mean, I think that's another thing, because if your first cycle, you're used to it being very heavy, you think that's normal, right? And not realizing, well, this is excessive. So, yeah. So I think part of it is what we're exposed to, and part of it is, you know, what we learn as common knowledge.
Yeah. Societal stigmas too around this stuff definitely still changing. And I think it's getting better, which I'm really glad for, but definitely it's still there.
And I think it varies from country to country and you know, city to city. And like for me being an OBGYN in labor and delivery, we have zero filters, right? Everything is discussed. So sometimes, like, you know, I was having dinner with my family one night and one of my patients calls, right? She's pregnant. She calls me and she's like, hey, I'm bleeding. And I'm sitting at the dinner table. I was like, did you have sex recently? I was like, oh, well, maybe I shouldn't be asking this question in front of the dinner table while my family there and kids included, right? Like, that's the first questions we ask when pregnant patients are bleeding, because they had intercourse and it causes bleeding.
It must be so cool to have an OBGYN as a mom. I'm not gonna lie. Like, it opens up so many conversations.
It depends, because, you know, like, you're not necessarily always comfortable discussing things with your mom that are personal versus like a stranger. But I do throw it at my kids. Like my second daughter is 29. So my oldest is 30. She got married last year. My second one was single until recently, right? And she's just busy climbing mountains all over the planet. So I'm like, you know, just FYI, like, you know, if you do eventually want kids, you could freeze your eggs. Just, you know. So she's like, oh, okay, I'll keep that in mind. So, you know, if I have time and I'm in one place long enough, I'll consider it, you know.
It's good you planted that seed first.
That is a nice option for us women now, because we can freeze eggs, right? So, and the younger you are, the better the quality of the eggs and the more bang for the buck, if you want to put it that way, because you know, with the same medication, we could stimulate more eggs to mature.
Absolutely.
So I think that's a huge thing that frees up us women from the pressure of like, oh my God, I need to. So like I said, I don't just necessarily agree with that you have to be married before you have a kid, but like, you know, I have to find the right partner. I have to find a partner. I need to find a partner so I can have a baby before I'm too old, right? So I think in that sense, it really frees up, you know, that part of the stress quite a bit. But still, you know, your body's not the same when you have a kid at 40 versus 20.
Absolutely. And I feel like there's so much gold, and we might be talking about this a little bit later in Sandra's segment. So we'll go ahead and wrap up this one with one last question. For our last question, about 70% of women in their 20s use birth control, and most commonly the pill, either for pregnancy prevention, period regulation, or both. So we also know that it doesn't cause, but it can mask underlying hormonal issues. How do you really navigate this with patients? When is birth control the right solution versus when might it be hiding a problem that needs addressing?
I mean, I think, for one, I love the birth control pill. So that's a personal thing. But I think before you know, contraception aside, right? We like to use the birth control pill to regulate the hormone, to regulate our cycles. But obviously, like if you came to me, you said, hey, you know, I used to have monthly cycles, but now I'm only getting it every 5 months. I'm not just going to throw the birth control pill at you, right? I'm going to run blood tests to make sure there's not something else going on before we say, okay, there's nothing bad going on. And one of the options of treating it is birth control pill. So I think it behooves us to not just throw the pill at people without knowing what the diagnosis is, right? But that said, the birth control pill is amazing for a lot of things, you know. So theoretically, and I do have people who react differently, but theoretically, it, you know, decreases acne, it decreases the PMS or the moodiness, it decreases the bleeding. So for people who have heavy bleeding, it's a wonderful way to control it, right? And then for people who use it for more than 5 years, it can decrease the risk of ovarian endometrial cancer by up to 50%. And also endometriosis is one of those things where it's often subtle, but even if we knew you had endometriosis, what's our first drug of choice? Birth control pills, right? So if let's say you had endometriosis but hasn't been diagnosed yet, and we put you on birth control pills, we're still protecting you from the endometriosis, progressing as quickly. And same thing with PCOS. One of our favorite drugs to use is birth control pills because it keeps your cycle regular. And in PCOS, actually, one of the things that happens is the hormone, the local environment around the ovary changes. So it makes the ovary, it makes the skin kind of thick so that when you ovulate, the egg doesn't release as nicely. So birth control pills actually protects the ovary in that sense. So even if you don't have a definitive diagnosis of PCOS, being on the birth control pill still protects you. So like I said, I love that stuff.
I learned so much just in that little answer. Well, thank you so much, Dr. Chen, for all of your insight and your nuggets of gold. I'll go ahead and pass it off to Sandra to continue the conversation. Thank you.
You're welcome.